Let's talk about dementia. It's this huge health challenge facing India today. But it's one we don't talk about nearly enough. But what if I told you there's actually a clear, totally practical roadmap for how the nation could get ready for this? Well, in this explainer, that's exactly what we're going to break down. And this question, it gets right to the heart of it. This isn't just about medicine, it's about looking ahead, about being smart. It frames dementia not just as a personal tragedy, but as a national challenge, and one we can absolutely meet if we have the right plan. To really get what's at stake here, we have to make it personal. So just imagine a grandmother somewhere in a small village in India. Her family starts noticing these small changes. She's a little more forgetful. It's a tiny moment, right? A super common one. But for millions of families, that's the beginning of a long journey. And yeah, that's where our story starts. So that story, that personal moment, it's happening all over the country, right now. And it's putting India at what you could call a dementia crossroads. And look, it is a huge, huge challenge, no doubt. But it's also an incredible opportunity to build a healthcare system that's more compassionate, more innovative. Okay, so before we jump into the solutions, we have to get our heads around the sheer scale of the problem. And honestly, the numbers here, they are absolutely staggering. 20 million. Just think about that number for a second. That's more people than live in Delhi right now. And by 2050, that's how many people in India are projected to be living with dementia. A number that big, well, it's not something you can ignore. It demands a plan. So you might be asking, where does a number like 20 million even come from? Well, it's all tied to this massive demographic shift happening in India. By 2050, India is going to have over 300 million people aged 60 and up. And here's the kicker, your risk of getting dementia basically doubles every 5 years after you turn 65. So you put those two things together, an aging population and that rising risk, and you've got a perfect storm. So when we talk about dementia care, who's actually doing the work? The answer is staggering. A full 90% of that care comes from family members, unpaid. This is emotionally and physically draining work that puts an unbelievable amount of pressure on families all across the country. And if that wasn't enough, you've got the geography of it all. Almost 70% of India's older adults live in rural areas. Just let that sink in. The vast majority of people who need care are in the very places where it's hardest to get a doctor, to get screened, to find any kind of support. It's a huge, huge gap. But it's not just about access to clinics. There's this deeper cultural barrier. There's this common saying, "Budde hoge chalta hai." It basically means they've gotten old, it's normal. And that one phrase, that simple idea, captures this widespread belief that losing your memory is just a natural part of getting old. It's not seen as a medical condition. And because of that, a real diagnosis can be delayed for years. So you got this cultural mindset, and then it's made so much worse by these huge gaps in the healthcare system itself. I mean, we're talking about a serious lack of specialists like geriatricians and neurologists. There are hardly any memory clinics once you get outside the big cities. Most primary care doctors just don't have the training for this. Then you add in social stigma, a care system that's totally fragmented, and it all adds up to a system that is just not ready for what's coming. Okay, so the problem is big. It's complex. It's easy to feel a little overwhelmed. But here's the good news. We are not starting from zero. Not at all. There's a really clear global blueprint out there from the World Health Organization that shows us the way forward. The WHO's plan is actually pretty straightforward. It's built on 3 key pillars. First up, prevention and risk reduction. That means managing things we already know about, like high blood pressure and diabetes. Second, getting an early diagnosis through timely checkups. And third, and this is so important, post-diagnostic support. That's not just for the person with dementia, but for their caregivers too, giving them the resources and help they desperately need. Now, this is where the story for India gets really, really interesting, because it turns out India is in this incredible position to actually do this, to put this global blueprint into action. And why? Because of the multi-layered public health system that's already in place. So let's quickly break down how this system works, because it's a beautiful bottom-up model. It all starts at the community level, with the frontline ASHA workers. Those are the accredited social health activists. They are the link to the primary health centers, the PHCs. From there, you go to the district hospitals. And at the very top, you have the major national centers like AIMS and NIMHANS. This whole structure, this existing ladder, is the perfect vehicle to roll out a national dementia plan. Let's zoom in on those ASHA workers for a second, because they are the secret weapon here. These are women from the community. They're trusted. They're already on the ground handling everything from maternal and child health to screening for other diseases and counseling families. Now imagine, with just a little bit of extra training, they could also learn to spot the early signs of memory loss. They could use simple screening tools on a phone. They could provide that first line of support to caregivers. This isn't a small tweak. It's a total game changer. And then you layer technology on top of that, that's when things really take off. Think about it. Teleconsultations can connect a patient in a remote village with a top specialist in a city. There are new digital apps that can help screen for dementia just by analyzing someone's voice or the way they walk. And electronic health records can help track those small cognitive changes over time. All of this makes the whole process low cost and something you can scale up across the entire country. And look, this isn't just a theory. We know this stuff works because it's already being tried and tested on the ground. Pilot studies in places like Kerala and Tamil Nadu are showing really promising results. They're finding that when you raise awareness, communities get on board. These low-cost screening tools are actually effective in local health centers. And, no surprise, supporting caregivers is absolutely essential to prevent burnout. They also found that piggybacking dementia care onto existing programs for things like diabetes and hypertension makes everything way more efficient. So when you put all these pieces together, the community workers, the technology, the proof from the field, a really clear vision starts to emerge. A vision for a dementia-ready India. So what are the most promising, most concrete strategies to make this happen? All right, here it is, the practical, actionable checklist. First, train the ASHAs in basic cognitive screening. Second, make dementia care a standard part of what health and wellness centers offer. Third, get a memory clinic set up in every single district. Fourth, use telemedicine to bridge that rural-urban gap. Fifth, promote risk reduction by bundling it with existing health packages. And finally, and this is so critical, create caregiver helplines and counseling. Every single one of these steps is doable. So now, let's go back to that grandmother in the village we imagined at the very beginning. In the future we've just laid out, her story plays out very differently. This time, her local ASHA worker, someone she knows and trusts, notices the changes and does a simple screening. A doctor at the local health center is able to give her an early diagnosis. And her family, they get the counseling and support they need, maybe just through a simple video call. Her life and their lives are changed for the better. And that really brings us to the most important takeaway from all of this. This roadmap for a dementia-ready India, it's not some far-off, impossible dream. It's achievable, it's affordable, and for millions and millions of families, it will be nothing short of life-changing.